All right, we're going to reconvene our work session with a report from the SHAC committee. And we'd like to welcome Lee Skirpsky, Director of Office of Operations and Strategic Planning, David Whiting, Chair of SHAC, and Phyllis Payne, Co-Chair of SHAC. Welcome, and we look forward to hearing your report. Who would like to lead off?
I guess I'll go for it. Thank you very much for having us. There's no PowerPoint presentation. As members of SHAC, we believe very strongly in limiting screen time, and so we're going to be enforcing that tonight.
Is that metrics?
Yes, definitely.
Really, I didn't see it.
So the School Health Advisory Committee, we're comprised of medical professionals, mental health professionals, practicing physicians, academic experts, academicians, FCPS staff experts, and me. So I think my job here is to be the good looks and charm. I'll try and do my job tonight. This time last year, the previous chair, Chris Gare, and I were here to discuss the creation of a comprehensive wellness policy, which has been a longstanding goal of SHAC, sped up a little bit by the passage of the Healthy Hunger-Free Kids Act, which was passed in 2010, and a final rule took effect on that passage in 2016. So that's sort of given us the impetus to bump up the priority on these policies and the accompanying regulations. You guys gave us the charge this year of creating a regulation which went along with the policy. We met that goal. That regulation has taken effect as well. Both the policy and regulation are in full effect. The next step in the ladder of tasks is to create a metric which allows the school board and the school system to account for how well schools are reaching the goals stated in the policy and the regulation. This is all part of the act, and it also is it's good sense. We want to know how effective this policy and regulation is, where it can be strengthened, where problems are. That's been our goal this year. We've created the metrics. We've submitted it for your approval. It should be in your materials tonight. In addition, we had a really fabulous working dynamic in the committee this year. We have explored a number of topics for ways to improve the policy going forward. So it's been a really nice meeting of the minds of both FCPS staff and the community experts. And so we're very optimistic about our ability to improve this stuff going forward. But tonight, the immediate goal is the metrics. And so we are here to answer any questions you may have and ask for your approval thereof. Also, dad power.
All right. Phyllis, would you like to say anything? That was it. All right. Well, that was short and sweet. Thank you so much. Mrs. Strauss.
Okay. First, so that I understand the metrics. Mm-hmm. Well, first of all, two recommendations. One is to make sure that each school has a wellness committee, correct?
That's correct.
Okay. And so our first question with that is how far closer away are we in actually achieving that? Or is this a new recommendation for next year's school year?
You can do it.
It's new.
Okay, so we won't know how, so next year we'll find out how that's going.
Right.
And in terms of the metric, it is the survey.
The metric is essentially a survey that's completed by the Wellness Committee. This Wellness Committee should be created by school principals, one at each school, over this coming summer. The regulation requires us to have this metric completed school by school by the 2017-2018 school year. So it all comes together this coming year. We need to have answers to this metric. And we think the best way to get that done is to have a wellness committee created in each school by the principal. We've recommended that the principals invite a parent, a faculty member, the public health nurse that works in each school, and in age-appropriate school settings, a student representative. So middle schools and high schools, you could have a child. So the idea is not only to get this reporting done, is we're not just checking a box. We're trying to get the wellness messaging out to the community so that parents who hear issues of student suicide or nutritional deficiencies or kids aren't getting enough recess time, parents see what FCPS is trying to do to address these concerns. So the wellness committees get the messaging out. If you have a parent representative, someone in a strong PTA, that sort of disperses through the parent community. If you have kids out there, kids get interested. So we're trying to get these committees to be not just box checkers, but really effective communications tools.
Well, and the idea was we wanted to also leave flexibility so that in different schools you might have volunteers that are interested in different things, staff members who are interested in different things, principals who are interested in different aspects of this, so that they might, if they have a biking enthusiast or something, they might, focus the year on adding bike to school activities or after school bike programs or whatever it might be that, and if it was my school, I might do a sleep education and awareness activities and that kind of thing. So just to allow whatever the local resources are in terms of, people, volunteers, students too, obviously. I mean, I think even at the elementary school level, you sometimes have students that are charged up about a certain activity, and maybe they don't think of themselves as advocates, but they're learning to be advocates already in, as part of the health curriculum. And so this gives, we're hoping to really give this thing legs by having each school be able to create its own wellness committee with its own character and its own strengths, and then share that back, and hopefully maybe even share success stories from different schools, so that if one elementary school is doing a great walking before school program, then they share the story, and maybe someone else will pick it up the next year.
So in terms of the survey, which that is your intention, that's going to be the major metric. In terms of the survey, is the intent that this would go out to all the parents? I mean, who do you envision? If it's just the committee, how will the committee?
The wellness committee would respond to the questions.
Okay, so you don't see this as something where you
it wouldn't go to everybody.
Greater reporting. And then I guess the question would be, how do you get? Because I think the questions are really very interesting, but how do you ensure that the response is scientific enough to give us enough of a sense of how it's going? Because if it's just the committee members reporting back.
Well, it would be the principal's job to see to it that, to the best of his or her ability, these answers are correct. So we can't guarantee scientific accuracy on these. What we're trying to do is create a baseline of reporting, so that we as a committee and you guys as a school district can compile these responses and see where the needs are. So a lot of these questions, we've taken the policy and the regulation, gone down the list, and compiled all the things that we as a committee think are really important to know. And we have resisted the impulse to compile information that is prohibitively difficult or expensive for the schools to compile. So it's a balancing effect. We're trying to get the best data we can so that we can have a baseline from which we as a committee can recommend how we proceed in the future. What areas need strengthening, what areas need more information, what areas we don't care about as much.
It was a challenge in terms of, we started out thinking, okay, well, we want outcome measures. Let's find out, use the youth risk behavior survey, try and tie all these things together. But this is the first year. So getting the wellness committees off the ground to begin with is a success, if we can do that. And then having them report back and begin to work on implementation of these things is sort of as a kickoff year.
Because the one, and I guess we have to wait to see, to get the committees going and to get the reporting back. Because the one concern that I would have is that I like all the questions that you're asking, but the answers could be skewed, because it may be where the principal says, yes, all of these things happen, but then maybe class by class, teacher by teacher, they don't. Or the parent says, this is not consistent throughout my school, because, some of the things may be in the master schedule for the school, but maybe they don't always be careful. But I guess we'll have to wait to see how it comes out.
Right. I think it will be skewed. I think we don't know. I think there are 200 schools in Fairfax County.
Right.
I think over the course of those responses, we'll get a sense of decent data. It won't be perfect data.
Right.
We'll see where the needs are. So principals are not going to want to say, no, our school is not enforcing the rule. They have a minimum recess period. Who's going to say that, right?
Exactly.
But we still need, I think it's our job as a committee to recommend that we collect that data, because that data is important to show our compliance with the federal regulation. So it's that we're meeting our federal obligations, we're meeting our responsibility obligations, and we're getting that messaging out into the community that people are watching, people are interested in this. It's important to parents. And as a parent, I'm a parent of 2 kids. I'm a PTA president. I do all kinds of stuff with the schools. I, as a parent, want to know what FCPS is doing to address the health and wellness issues. So what are you guys doing about food? Well, here's a policy, here's regulation, here's how it's being implemented, here are the successes and failures we have with the implementation. And take that across every health and wellness issue. It provides everybody with positive incentives to do better, to get good information out there, and to have a constructive dialogue.
I mean, maybe this is Pollyanna too, but we did have administrators on SHAC advising us
Right,
about.
and you have some very, very responsible ones, because
Yeah.
I know them,
Yeah.
I know, it's a great committee. But I would want to know that the information we get back is reliable enough for us to base decisions on it.
Well, they were actually saying in some cases they might say no or needs, not applicable, or if they felt they needed more resources, for example, and they couldn't meet some of these because of something like that, that this would be our tool to finding out more about that as well.
I guess on the positive side is that these are the things we care about. And what this does is it sets a baseline. This is their expectation for how health and wellness should be carried on school by school. So if a school is not meeting them, at least they understand the expectation for what the committee is recommending that we strive for.
And it definitely is not every single thing that's part of the, we did pick and choose to try and find that balance so that people would actually be willing to fill out the survey.
Right, because I know, that's always
Hand it in.
that's always the challenge, okay.
Yeah.
Anyway, thank you.
Does that make sense?
And if we find that we get 180 or 200 yes answers or exceeds answers to a question, you'll be hearing from me next year saying we need to strengthen this metric so we can dig deeper and find out the answer to your question.
Mr. Moon?
Just a couple of questions. First of all, metrics. Is that your recommendation for the board to formally approve those metrics
Yes.
at a regular school board meeting? Vote up or down and modify? Is that what you're asking?
What is the technical detail? How does this technically happen?
Well, I think what we're looking for is just feedback as to whether or not we believe that these metrics would satisfy the reporting requirements. And as a group, we really felt like this would offer us some great baseline data, especially for the first year of reporting. Our goal would be to open up reporting to schools in February and March of next year to allow us time in April and May in our last 2 SHAC meetings to have some of that feedback as a system. Our plan also will be to work with our IT FAST team. We actually have a precedence for this type of reporting. We previously had the Golden Wellness Award, which was an optional reporting for some schools. What we are going to do is replicate that application. That would allow schools in the same way to enter their data. There would be assigned staff members that would work together, but also community members, wellness committee members to complete the reporting, and it would be approved and submitted by the principal as we did with the Golden Wellness. So in working with them, they hope to be able to do demos and testing in November and December, create user guides to work with staff so that they'll be able to enter the data. Hopefully it'll be something they're relatively familiar with, and then we will have time to look at this information. But since it's something systemic, we were really looking for approval from the school board as something that we would be implementing with our school staff.
Okay. As to school wellness committees, I was looking at the regulation dated October something of 2016. So school wellness committees, maybe it goes to staff. Out of 200 schools, how many schools do have wellness committees already in place?
Well, currently the requirement is for a staff wellness liaison, and we do have Camille Bardis is here with us this evening. She is a staff wellness specialist, and we've been working very closely. And while we know that many of our schools have staff wellness liaisons, not every school, so we want to make that more consistent. So part of our wellness committee will be recommending that there's a staff wellness liaison to support that. And then every school is a little bit different. in terms of how progressive they are right now in wellness implementation. So some have informal committees and more formal committees depending on the school. Our plan really would be that there would be a minimum of at least 3 staff members that would be assigned at each school to be representatives, although they don't make up the entire committee. Their job will be to also inspire and encourage community members as well as students to become part of the wellness committee so that we develop robust committees at each school. So we plan to communicate with our principals in July through an actiongram and develop a contacts database with those 3 staff representatives so they can be leads in getting communications, maybe ideas. I know that Ms. Payne spoke about, what other schools are doing that is successful. We actually had a great year this year working with our Superintendent Student Advisory Committee. Jen Spears, who is also here, she's a mental health and wellness specialist here in our system. We worked directly with our students and heard from them, and they gave us a presentation at the end of our school year, and they also developed a database of their own wellness activities. So a thought might be that we could do something similar with schools and then find ways to network all of our wellness committees after we've established those in each school so that we can not only build more robust and student, staff, and community-centered and collaborative wellness teams, but also provide them with resources and ideas about things that might be successful in other schools that they would want to try themselves.
And we talked about, that some of our schools might have more trouble than others getting volunteers to participate, and, that maybe we could set up sister schools or, find ways to share the human resources, volunteers between schools.
Well, okay, thank you, but the responses were something longer than I expected. Whether under the regulations, whether it is our intent to see every school to establish a wellness committee,
That is
and
the
there
intent.
should be a staff liaison to the committee, and I think you might have already answered this, but the wellness committee can be composed of parents and students as well as staff members.
The
And
federal
they also-
regulation, it's very vague. So it's the committee's recommendation that we establish these committees with the principal, the public health nurse, maybe one other school official, and then invite other people to participate as appropriate at that school.
We want to make it very welcoming. I mean, that was
Sure.
a big part of our discussion.
But you do expect it is the responsibility of these wellness committees to oversee the implementation of activities on the wellness policy?
Well, to some extent, I mean, some of the wellness policy is really for example, health education, PE curriculum, physical activity during the day are things that I think would probably come, from staff and from the principal because they're, part of the curriculum or part of the schedule. But I would say, the extra activities that we're hoping will come from the wellness committees would be other ways to increase physical activity, other ways to, ensure healthy eating and
think
healthy sleep. And
The committee's job would be to observe, to record, and to inspire, suggest, be the principal's job to implement. And if principals find that for some reason it's impossible to implement the requirements of the policy and regulation, then we have a conversation with you guys in the future and figure out why and how to address it.
I was asking you those questions because as I was just reading what's in the regulation, that seems to say that it is wellness committees supposed to implement the activities that support the wellness policy.
so there would be some that they could and some that it wouldn't.
Okay. And just wondering whether, if the wellness committee is composed of, even though we are encouraging parents and students to also join the committees, if it is simply composed of staff, whether staff might feel that this is additional work on our part.
And so we definitely, that's part of the reason we also want to encourage broader community involvement. Some of what we talked about when we were developing the policy and the regulations was, school health as a component of overall community and public health, and involving other partners from the community. Maybe your school has pediatrician parents. Maybe it doesn't. Maybe you have nurses in your community who would love to bring, hand washing activities or, other allergy prevention activities and that kind of thing. So there's a lot of room in the policy, and not so much room in the regulations, because the regulations are the regulations. But the policy itself is one that is supposed to be aspirational, reaching beyond what's in the regulations to do more if we can, and to make connections. Even we even talked about actual health, access to care. And again, we can't, proscribe or prescribe that must be done. But if there are ways for our children to get access to health care that they might not otherwise have, we want to be moving in that direction. But again, that's not a requirement. That's more of a aspirational hope for the future.
All right, thank you. That's what I have for the time being.
Ms. Palchik?
Thank you. I really appreciate the work the committee put into this. I have a couple questions following up on Mr. Moon's, and obviously realizing this is would be kind of an initial year. I think the committee is a great idea, and I like that you were able to expand a little bit more on what it would comprise of. And perhaps it seems like down the road, as you start to do more of the implementation, it seems like first year will be really, let's start the conversation if it hasn't started. And as we move down the road, start to realize, do we need to reach out to specific community partners and other people to help us implement the work? So if I see head nods, so it sounds like that's a little bit what you're talking about. I had another question looking through these. I think these are fabulous questions. One, did the committee discuss pyramid work around these committees? I know we've started to have pyramid work around some of our mental health work.
We really didn't, but I know from my own experience in the community that is, it's an excellent way to share community resources, and certainly it's always inspirational, I think, when the older kids are coming maybe to the elementary schools and doing things there and sharing their passions, and so that would be great.
Yeah, maybe just to start to think about, right, are there tools that we're providing,
Right,
in
right.
5th, 6th grade or earlier as they go into middle school or high school? So I would love to maybe.
I think that's a great idea, and I think, there are a lot of ways that the high school kids can help the middle school kids, especially when you're getting ready for that transitional year. There's a lot of, even just coming and having a conversation.
Right, and a lot of this our schools are doing, so it might even be good to just have that here, right? What are the supports being provided from elementary school to middle school and middle school
Absolutely.
to high school?
Yeah.
So, and just to be able to compare, because some of this is making sure it's happening across the board, right?
Yeah,
So that may
yeah.
be one recommendation. Another one I have, I saw that in here, and I'm all about mixed methods. I see that for some of these, there are some areas that allow opportunity for narrative. I was trying to find, and I think the final one, the ideas, comments, and suggestions tend to be more focused overall on FCPS. I didn't see too many that were specific to the school and what's happening. So not to add more burden, but I was just wondering if we wanted to maybe give schools and the committees an opportunity, either by section or at the end, to kind of share either their next steps, things they've learned, highlights or challenges, so we can get a little more context to some
We
of
discussed
this.
that to a great extent, and it's a balancing act between, the onerousness nature of compiling one more survey of what's going on in the schools versus compiling useful information. And the narrative is probably going to be one of the more useful tools. So as a committee, we would love to see that. So if you guys want to encourage that, that's cool with us.
Okay. No, I appreciate it because I know, and maybe it's just adding one more question in section L, maybe give us something
anything else,
school-specific. Right. Okay. And finally, a big one for me is I know we've lost crossing guards since I was a student and a walker every day to school. And that's not just an FCPS issue. And I know that one of the questions, I can't remember the section, is about providing or encouraging safe Section E, our school encourages children to safely walk or bike to and from school. And while part of that may be the school, part of that is beyond the school's realm. So that might be an area, and I don't know if it was discussed of.
We considered asking for a narrative on that. My kids go to Flores Elementary, and it's at the junction of two streets, which make walking to school completely impossible if you're in the majority of the kids that go there. It's too busy and too dangerous. So there are going to be some schools for which that's a systemic problem. The principal can't do anything about the traffic flow. If we had crossing guards, that would be fantastic. That's a resources issue. I would love it, but that's above my pay grade to sort out. You guys have to do that.
But so that's again where you might see, not applicable or no, and then think, well, why is that? Oh.
Then next year we could dig down into why that is. How many schools are finding this to be a problem? And then if it's a substantial number, let's figure out why.
I think that on that section specifically, we did talk a little bit about this type of question, and with number 5, we were kind of intending with that they could identify barriers to a safe environment. So I don't know if we would need to reword that in a way that would offer them an opportunity, but I think that what we were thinking was with that final question for a healthy and safe school environment, that they would have the opportunity to share those barriers.
Right, so it could be school or community-specific barriers if it's beyond the school.
Sure.
Okay, perfect. Thank you. This is wonderful work, and I'd be happy to see and help support the way it's implemented. I know it'll be important, but it seems that even if schools are able to do this once next year, right, just one time, come together, let's start a baseline, I think it will give us some valuable information.
Well, and the requirement of the legislation is it's triennial reporting, is that correct? Once it's up and going?
Yes.
So this doesn't just have to be every year, the more the better, but if we find that it's too onerous, we can ease it back.
Thank you so much.
Thank you.
Mrs. Corbett-Sanders?
Thank you. I really enjoyed your report, and I love your metrics. And I'm glad that you mentioned that they have an obligation on a triennial reporting. What would be very helpful is with the triennial reporting for you to actually provide us trend analysis so we can see where things change over time and if the wellness committees are being successful, because ideally then your trend data will be positive. I do have a couple of questions regarding the staff members. You recommend 3 staff members in addition to community members. And my concern is that for some of our smaller elementary schools, 3 staff members may be tough. So how did you get to 3?
We thought it would be appropriate to have a principal as sort of the point person for the school. That would be helpful to be on the committee. The public health nurse that works at the schools, that's not necessarily at that school every day. That's just not how Fairfax County works. That person could be a member of the committee, and then any other teacher. It wouldn't be essential. This would be our recommendation for principals in the creation of these committees. It's not mandatory. It's not binding. If it doesn't work for a particular school, oh well. But we as a committee think that would be most appropriate to have 3, so there's multiple voices, multiple perspectives, multiple avenues to distribute the importance of this information, and then an invitation to the community to join as well.
Okay. I think it's really important to have the community on the committee, and I would encourage that, especially since many of our schools split the health nurse, that a physical education teacher or a social worker or somebody else in the building that has those type of responsibilities might be appropriate. You mentioned the database of activities that the students provided to you. I noticed on the website that there's no linkage to great ideas really on some of these, and so it might be helpful to have that database of activities linked on the website so that when, my children were real active in the leadership of their high schools, and the leadership committee actually took on the wellness, and they would do wellness weeks and they would do wellness activities throughout the whole year. And so I think that would be very helpful to have that database centrally located and easily accessible.
The students actually, I know they developed it this year, and they're going to be working to finalize that over the summer and then sharing that out. So it may be a great opportunity. We have our Student Wellness Tips webpage that Ms. Spears supports as well with our communications department. So that would be something that we could get some great ideas from and add. She's actually the leader in helping to put the content onto the webpage.
Well, once you have that, if you make sure that we know about it, most of us are pretty good about making our constituents aware of great resources, and this would be a great resource that we would like to share with the community. Additionally, you talked about the food and the question of nutritious meals. My question is, what happens? Is there a question on your, or is there a metric regarding students that run out of money on their meal card, and are they provided with a nutritious meal? Because this continues to be, or is creating, a groundswell across the United States of students who are not given nutritious meals.
So that is not in our metrics, and the reason why is in the metrics we attempted to follow the policy and the regulation as verbatim as we could, that being an adjective. If we start adding stuff in the metrics, then it almost becomes sort of like a quasi-policy, and we didn't feel that was appropriate for us to do that. I think that's a wonderful piece of information to compile. We'd like to know that, and that's definitely a problem that should be addressed. It's not in here at this time. We could add it. I mean, if that's something you guys would recommend, we can do it. But that, I think that's more of a policy point.
We talked about, this might be jumping the gun, and I don't want to steal your thunder.
Go for it, man.
But we talked about, because as we were doing the metrics, we were coming up with other things, and we had to stop ourselves and say, wait a minute, that's not in the policy now. Oh, maybe it should be in the policy. Why didn't we put it in the policy? And so we sort of said, okay, we have like a whole parking lot of other ideas that we want to talk about next year. I mean, there's quite a few things queued up for September based on, things community members were bringing to us, and then just our own ideas as we were going back through things. And so, yes, we want to strengthen some things, and so maybe we could add it to the policy, and then.
Or you can put it in your parking lot that's getting fuller and fuller in for the fall. And along those lines, in the section F regarding school counseling, psychology, and school social work services, I know that some of our high schools trialed the Cognito training for suicide prevention, and I see that you ask, or you have a statement, our staff has received required suicide prevention training. It might be helpful for the high schools to have a question, and it may be in your parking lot, but a question regarding our students receiving suicide prevention training.
It's definitely on our radar screen of important issues next year. There's sort of an amalgamation of student stress, suicide prevention. It goes down into the weeds as far as high school sports practice times, just the overall burden on students, number of AP courses that are allowable, recommended. All these things go into a basket, and that's priority number one for next year, student stress.
And then we also have for the younger kids, we've got recess. There
are a number of things, yeah.
Yeah, okay. So it'd be great to hear you all address those in the future.
Love to.
And then finally, thank you for raising the question about biking and walking to school. I would share with you that one of my schools has a virtual school bus. And the virtual school bus is a teacher and a parent in the community who walks the children home to an apartment complex, and otherwise they would be on a bus or waiting for kiss and ride. And it has been a wonderful opportunity for the kids to get out and walk, but it also shows to them that they have a caring support system in this community as well. So the virtual school bus is something that I would encourage.
Great idea.
Absolutely. And I love that idea. And I love, because it's also community building. And that's the kind of thing I think you can really do when you've got volunteers who care about that kind of thing. And, it just takes a person.
And it's a Title I school.
Mrs. Schultz?
So it's interesting, Ms. Corbett-Sanders hit on a couple of questions I had, really around the three staff members, and whether there's been any thought of, in the world of more initiatives and more things on people's plates, how you balance this with other duties and how you select the right people. Because if you just put something else on a principal's plate, does this just become another thing another unhealthful thing on their plate? Right. And I am concerned about that, and I'm concerned about the disparity between, even just say an elementary school to an elementary school. I have elementary schools with 1,200 children, and I have elementary schools with, 500 children. So, is 3 the right number, or, is there a suggestion around who could fill that? And might it be somebody like not a classroom teacher and not the principal? Could it be somebody like, a PE teacher or someone else? Was there a lot of discussion around that?
I think that when we came up with what we thought would be a good number, certainly that's something that we could reevaluate. Historically, we've had one staff liaison, which schools have been expected to have that representation from the staff perspective. And when we did Golden Wellness reporting, we actually did have 2 representatives, a PE teacher most predominantly, and an FNS representative at the school. So we know that historically we've had teams that have been able to do this with Golden Wellness reporting. So we looked at a similar model in the recommendation.
Was the FNS employee paid additional hours or time?
I'm not sure how that would work, but how that worked at the time. Liz Payne is a member of our SHAC committee and was involved with the development of Golden Wellness and the implementation when they did that a few years ago. I think that we have stopped doing that reporting over the last few years, but I can certainly find out more information about who those staff members were and how they may have either been compensated or who would actually have entered the data.
And not to be sort of pedestrian in the approach about this, but is there a specific goal that you're driving to get from each school as a result of this? Not that it's good to have this, good to have the focus on it, but is there something that you're like, a dipstick of, we know where you are and we want to move the needle with this threesome, or?
Well, first of all, I would encourage pedestrian questions. I think that's good exercise. Secondly, I think it's just the piece of awareness. I think it's as was mentioned earlier, getting people to ascertain where they are on meeting these metrics, and then find some method towards improvement. Find out where the school's weaknesses are, understand that each school has different needs, different abilities, different means, and then within the context of that school, figure out how to make students healthier and more well.
And we're really hoping that community members are going to get involved so that it won't be limited to the 3 staff people. We know that at some schools, I've been to those PTA meetings where, there's 2 parents and everyone else is staff.
And it's the same 2 parents for like 7 years in a row.
Yeah. Exactly. But, so we're hoping, to get feedback after that first year and to maybe even look at, okay, this school only, didn't have anybody. Who didn't have anybody? And then who has, a plethora of, like too many people? Like, can we get these 2 schools together and share that resource?
Because my thought would be, just as a suggestion, would be there's got to be a couple of big buckets that are the most significant, regardless of the fact and acknowledging the fact that every school's got a different set. But there's got to be some common buckets of, look, how can you affect the most number of people, immediately? And I know this sounds dumb because I always spend probably at least 25% of my time at NSBA on the vendor floor, but it's because that's where there's some innovation happening. And kids sitting in desks all day long is a problem. And kids standing, engages the mind, engages the body, all kinds of things.
I was going to say, I heard you earlier say you're the mother of boys. I'm a dad of 2 boys. And in my mind, one of the easiest and best things we could do right away is extend recess. 15 minutes a day is inadequate. It's just flat inadequate. And so if we can get more quickly, that would be a great way to reach people.
I had thought, and nobody can laugh at this because I really, really did think this, that if every school started off the day, because elementary school kids are little, middle school they're bigger, high school they're bigger, and their schools get bigger, that if everybody walked around the building once, twice a day to start off their day, run, walk, whatever, what would that do?
It's already implemented for kids, and I have a special needs son, and one of his accommodations is to go get exercise first thing in the morning because that helps. That's not just special needs kids; that's everyone. So that's a great idea.
So big things like how much seat time are they getting? How much screen time are they getting? How much recess they're getting, and are we able to do things? Are we able to innovate outside and do? I mean, we live in Virginia. I mean, we're pretty lucky that a lot of the year, we can be outside, and that being in a industrial carpeted, industrial tiled, industrial ceiling tiled, building all day with fluorescent light. I mean, just and. Those are healthful things, vitamin D, et cetera, that sort of, it would be an easy turnkey thing. It would just, the only thing it takes is our mental approach to it. And boys, of course, learning outside is great.
Well, I don't have this memorized, but we do have some increasing physical activity.
Right. Increasing, it can be
So
in
that,
PE class or
instruction
recess.
doesn't have to just be, right? Like the physical activity doesn't have to be limited to PE
Right.
or recess.
And there is innovation available insofar as just scheduling. There are kindergartners at my school who don't get recess until 3 o'clock. And that's ridiculous for a 5-year-old boy, especially to be expected to sit still from 9 to 3 before he can really move. That doesn't work. So that could be improved immediately.
That's actually a suggestion that should be made because I have been in that situation as a parent where I ask about the day and the last thing of the day was recess. And why?
Right.
Why? Like, no master schedule at an elementary school should allow for that.
I would quote you on that.
Thank you. I will take a turn. And there's so many things I want to say about all the work that you've done. I just want to start by complimenting this committee on the work over the last 2 or 3 years. I mean, this has been substantive, comprehensive work. And I've said it before, I'm going to say it again tonight. I think the creation of the wellness policy is one of the great achievements that we have had in the last couple of years in the school system. It's been rather unheralded, but I think that it's one of the most important and most significant things that we have done. So thank you for all the work that you've done, because your committee has really guided this process, in a very, very comprehensive and substantive way. So thank you for that. So we're here in part 3, aren't we? I know we went, we have the policy in place, we have the regs in place, and both the policy and the regs are very comprehensive. And I was very pleased with the work that was done on that. So now to get to the metrics. I did want to get clarity on a couple of things. I've been through, and the report says that the law requires the wellness committees, but we're to encourage wellness committees. I mean, does each school have to have it by federal law, or does it not?
The committee required by the law?
Do we know? If you don't know off the top of your head, you can get back to me on that.
I don't know off the top of my head if a committee is required or if just school district responses are required.
Or just school, okay.
It's vague on purpose. The federal rule applies to a zillion school districts, so they want to leave people flexibility to implement it.
Okay. I would appreciate knowing if the law actually requires it, or if we're telling schools, you must have this committee because it's federal law, or if we're telling schools, we really, really want you to have them. You know, it's perhaps a small difference, but I think it could be important. And then when I look back at the policy, it talks about the where is this? Under implementation, the school division will establish a wellness policy leadership team of one or more school officials who will have the authority and responsibility to report on each school's compliance. Is that something that's in the works? Do we have that now?
What we had written into the policy and regulation, our intent would be that the School Health Advisory Committee would look at that annually and make recommendations on the compliance of our wellness policy and our progress in terms of reporting. We also have wellness leadership established on that committee by representation cross-departmentally with ISD, DSS, Food and Nutrition Services, Safety, Wellness and Facilities, and Human Resources.
So is that to say that the wellness policy leadership team, that SHAC serves that purpose? Or I may not be understanding you. You're saying that
our intent was that SHAC would serve that purpose.
SHAC is serving that purpose.
And that would be our opportunity for public involvement, sharing our information with the public so that public members could attend SHAC meetings and provide feedback and information, also making public comment. And then our wellness leadership team, we actually have staff representation in each department that also serves on that committee.
Okay, that sounds good. And so you're asking us to actually approve these metrics, so you'd like to see this on a school board agenda then, at a work session and a school board agenda, and have us affirmatively
Yeah,
act.
just as you approve the policy and regulation,
Okay.
we feel it would
Okay.
be an appropriate statement.
So we can try to, we'll schedule a work session and an agenda item to consider this. So that we can certainly do. I think the metrics look great. It will be interesting to see what we get once once the schools create the wellness committees. And like you, I hope they don't just say, yes, we're doing all of this and not put the thought into it. You know, we want to make sure that they're telling us where there are holes that we need to fill and where we need to go back. So it'll be interesting. It'll be interesting to at the end of a year to see what reports come back from the wellness committees. And other than that, I'm just you've raised a bunch of things that you've put in a parking lot, and any one of these things would be I think I heard you say homework load, number of AP and IB tests. Length of sports practices, these are all in your parking lot, the length of recess, and you mentioned at the very beginning screen time. Are these things that you're planning to tackle in the coming year?
Yes, in addition to substance abuse, school health models, the staffing ratios for public health nurses, and even things as small as the cleaning chemicals that are used in elementary schools. I don't know why it is that we ask kindergartners to spray stuff with class 3 toxins when kindergartners clean like kindergartners. If they're not actually disinfecting or sanitizing, why don't they just use water? Isn't there a better way to do that? Things like that. We're trying to think these things through. We have a list of things to talk about.
Well, you're making my heart sing with all of these things that you're tackling. Things that we did make a stab at sports practices. We have some guidelines.
There are guidelines in place. We found it was interesting that the rule is, I think, 2 to 2.5 hours is the cap on sports times. There are some sports which require setup, which take it to 3. We had a member, the student representative on the committee, was finding that her sports practice times were exceeding that dramatically. So there are rules in place. They're not always being met. And so, as you say, it's interesting to see what what reporting we get back next year, whether it's accurate or not, as your colleague was suggesting.
It was pretty fascinating to the one student that was in the room to have her say,
It's not being,
not
the
happening.
guidelines aren't being met.
Not even close.
Well, that I would love to have SHAC tackle that issue, because I do hear that from students, in particular on some specific sports where they're there for 4 hours or more, 4 or 5 hours, and I think the experts will tell you that that's not good for the in terms of practicing either. It doesn't really, in most cases, help the athletes if you have too much of that. Of course, the recess.
in that report, we did hear from Mr. Curran that, 2 to 2.5 was,
Optimal.
yeah.
I think that was the
That
cap.
was-
And there were wonderful things being done, too, as far as analysis of concussion risk and injuries that students are having and ways we can mitigate those risks.
They've
that
done
was
some
fantastic.
marvelous work on
They've done great
concussions.
work, but there are some
Yes.
areas where we need to improve. So
Right.
that's what we're trying to keep an eye on.
And I think another thing we're going to grapple with, this is nationally, we're grappling with it, is the number of AP and IB. We're hearing of kids taking 6 a year and just exhausting themselves in this race that we've got. And I'm not sure what we're going to do about it, but I would love for SHAC to give us some recommendations on
It's a
what we can do.
fascinating area of discussion, and there's a top-down solution that could happen. We could magically make colleges expect less in terms of AP commitments,
Yes.
in terms of student stress. That would be wonderful. I don't know if a top-down solution is possible, so maybe a bottom-up solution. Maybe if we kick the legs out from that stool, if Fairfax County students are only able to take 2 AP classes or 3, or figure out some sort of appropriate balance, then suddenly the requirements expected of Fairfax County students are more manageable and sane.
That's a conversation that some of us have started in a very minimal way, in a mild way. Ms. Hines and I, Pat Hines and I, when we were at NSBA last year, we had a conversation with a Harvard professor who had done a study on that. So I would love to see you pursue that. Recess time, of course, that's something we've been dealing with for at least a couple decades, maybe.
But now we have 6-hour and 45-minute days, so
So that helps
there's
us. Helps
plenty
us a
of
little
time.
bit, yeah. And just the moving, to Ms. Schultz's point, getting up and moving, throughout the day, yeah. Right. Yeah, that makes a difference too.
And
Anyway,
if-
I could
if
go
you-
on
If
and
you
on.
haven't seen the, and I don't know how many schools are doing this now, but Woodson has a really cool course selection scheduling planner. It's online, and you put in your courses, and based on surveys of the actual students who had that course the previous year, were asked, how much homework do you have? And so,
You can see reality then.
the predictions, and you're going to do chorus, that's this many hours, and so it has like a daily planner, so you can see how your schedule is supposed to lay out as a helpful, planning guide.
And it wasn't lost on me that you are asking them about flexible scheduling too for health, and that's something that is little advertised. We know that it exists, but it's little advertised. So I would love to see more of the flexible scheduling for better health as well. So thank you so much. I've got 2 go-backs. Ms. Corbett-Sanders.
Just wanted to pick up on your comment about the AP and IB course load. I spent a lot of time, many years ago, I was actually on the admissions committee at the University of Notre Dame. And then as my kids were looking at schools, I spoke to a number of different schools about this. But Notre Dame had an incredible statement. They said, we judge different districts based on what the district expects from their kids. So if there is a cap for AP courses coming out of a district, then we want them to take the maximum available. But if there's no cap, for example, Fairfax County, we expect Fairfax County students to take between 11 and 13 APs. Wow. And it was stunning. I sat there and I went, what have we done? Why aren't we putting in some sort of metric that says this is the max. So it might be helpful if you all were to survey admissions directors across the country, how do you assess AP courses?
All right, thank you. And Ms. Schultz, you had to go back as well?
Yes, and this is something I'm glad you brought up, the number of hours, that a schedule winds up. Because when Ms. McLaughlin and I have done our student town halls, one of the things we've talked about with students is for just 1 week, you need to have a planner that has 7 days and 24 rectangles in each column. And you need to fill it in with what happens in your day and show it to the adults in your life. Because I have a feeling along with this that we don't have a clue once they start bubbling in. Miss Evans, I'll do this for you. Once they put in sleep first, and then they add transportation time to school, and then they add getting dressed. Boys, I always say, and a shower because we have to remind them, right. And all the other things. And then fill in just the time that you're in class. What's left? And then, oh, by the way, there's the homework and the sports and the clubs and if you're working, how do you actually fit it all in? And I think it's something that not only these health committees, I honestly think we as a system ought to be talking about, because I don't think they can fit it in. And I think that what happens is the natural, Rob, is you take away family time, you take away meal time, and you take away sleep, and they drive too fast. So, everything else is, Paul, that Peter is robbing from. So, if you guys want to talk about that, I mean, it sounds like Woodson is on the cutting edge of this, but frankly, if that winds up being a good tool, duplicate, not reinvent the wheel.
One of the cool things they did too was, they did that survey of the kids about the homework, and then if a student had one teacher that the average was 2 hours a night, and a student had the same class with a different teacher and the average was 30 minutes a night, then they got those teachers together to talk about what are you doing differently, and let's try to,
My understanding, it is being rolled out. I don't know if Ms. Spears might be able to speak to that, but when we heard about the tool in Woodson, the idea is to try to start to roll it out in other schools.
Well, and I can tell you my experience going from school to school, pick a class. And so it's not just teachers within a building. If the class is being taught in one building and the next building over, the homework load is 3 to 4 times or 0, in comparison, then we don't have a instructional leadership issue. We have, or a mental health, we have a systemic issue. And that's one of the things that something like this will help inform the adults so that we can, because I don't think that sometimes we are, and that's why I think it's good to talk to kids, because we make policy at them, but never with them. And sometimes I think we could be better informed in how we're making policy decisions if we see how it operationally plays out.
And it gets the conversation going.
Thank you so much for your marvelous work. And we will, I will follow up. The only next step I had was to schedule a work session and an agenda item to look at these metrics and approve them. Did anybody else have another next step?
Not as a next step, but as a comment, whether they could take a look into a school board members' workload and their mental health.
I'll second that, Mr. Moon.
I think
Yes, and whether any of us gets any sleep.
There isn't
exactly.
I think we already know the answer to that. 'Cause
Yes.
I know you, so at the sleep conference,
Yes.
I mentioned how late the school board meeting had gone the night before, till I think it was like 2 a.m. that time that Sandy
I got
got
there
in.
at 2 in the morning, yeah.
And somebody said they should make a policy that school board meetings can't go after 11.
And with that, we will finish this. I'm glad you got the last word on that, Mrs. Payne. We'll take a 3-minute break between work sessions,